This video discusses the Choosing Wisely recommendation to not order lab testing or a CT scan of the head for a patient with an unprovoked generalized seizure or a simple febrile seizure who has returned to their baseline mental status. Here we present one example of a conversation between a provider and a parent.
I'm really glad to hear that your daughter is feeling better and looking like herself.
I mean, she is. Thanks. This was pretty scary. And I appreciate the stuff you shared earlier about how this was a febrile seizure and how she's going to be okay. I'm still kind of wondering if we need some blood work or maybe like a CAT scan of her brain.
I think those are really good questions. I think the most reassuring thing is that she's feeling like herself and her exam's completely normal, and everything that you've described so far sounds typical for what we call a simple febrile seizure. You're right that blood work can sometimes be helpful if we suspect an electrolyte reason or a metabolic reason for the seizure, but in healthy growing children like your daughter, that's unlikely to be the case. And more likely, it puts her through the trauma of getting an IV. Some of those test results can be erroneous and sometimes need to be repeated. So I think the risks of the IV can be higher than the benefit of finding any abnormality in the blood work. And I suspect in your daughter's case, a fever, a virus is the most likely cause for her fever. The complete blood count or a CBC doesn't show us what type of infection it is. And we have these large panels that test for all the different types of viruses, but oftentimes they won't find an answer, and we don't treat her any bit different as well.
Yeah, I mean, that makes a lot of sense. What about the CAT scan? I called my mother, her grandma, and she said to ask about one.
Again, a really good question. A CT scan is unlikely to show any abnormalities in her case. Again, because she's returned to her normal self and has a normal neurologic exam, and we found in those cases that the CT is very unlikely to be helpful. And the CT scan itself comes with its own risks. It exposes her to radiation and can increase the chance of getting cancer later in her life. So that's why we try to avoid getting it in cases like hers. I know it can be scary when something like this happens, and we all would feel more reassured with some blood work and a CT scan, but I think for her case in particular, the risks of the blood work and the risks of the CT scan outweigh the likelihood that we're going to find something that we don't already know, and so that's why I feel comfortable not getting either of those tests today.